Now, Singapore's migrant worker landscape will undergo key transformations to ensure better living conditions. The measures include regulating all dorms under a single act and having onboarding centres for new arrivals. It's part of the Manpower Ministry's overall strategy to raise standards and prepare for future outbreaks. Chloe Chu has more.
More comfortable living conditions are on the way for these workers as the Manpower Ministry pushes for tighter regulations in this area. It plans to expand the scope of the Foreign Employee Dormitories Act, or FEDA, to include all dorms. The Act imposes more stringent public health and safety requirements on dorms, but it only applies to the larger ones housing 1,000 workers or more.
Our experience in containing this pandemic in the dorms highlighted the need to strengthen our regulatory levers in order to enable us to raise and enforce housing standards very quickly across the various dormitory types and sizes, and to introduce new housing standards to make dormitory living more resilient to public health risks.
Dr. Tan adds that currently only 60% of 280,000 migrant workers stay in dormitories regulated under FEDA. The others stay in smaller facilities like temporary quarters or converted spaces. By having everything fall under a single umbrella, it'll be easier for the government to control an infection swiftly in the event of an outbreak. And it's not just daily living that the Manpower Ministry is looking into. It's leaving no gaps in the system by caring for migrant workers from the moment they enter Singapore. Migrant Worker Onboarding Centres, or MWOCs, will be piloted at 5 quick-built dormitories in areas like Eunos and Tengah. For a start, this will apply to work permit and S-Pass holders entering the country from construction, marine and process sectors. At the centre, they'll undergo more thorough medical examinations, complete their stay-home notices and orientation programs.
It benefits employers, workers and the general community in Singapore. For employers, bringing the processes together helps to lower the risk of transmission from imported cases, enabling the entry of more migrant workers to support our businesses. For workers, the onboarding program will help them start their employment in Singapore on the right footing.
The Manpower Ministry adds that it will continue to care for and engage migrant workers by ensuring that healthcare is accessible and expanding volunteer networks to deepen relationships with these workers.
Now, let's go deeper into this topic, and for that, we're joined by Dr. Tan See Leng. He is the second Minister for Manpower. Dr. Tan, now we all remember the criticism that came up last year when it came to the pandemic and the living conditions of the migrant workers. Now, the government is saying that it's mulling a new operating model for these new purpose-built dormitories. I'm wondering, what does this model look like? And what are the factors that you considered when coming up with this model?
Well, first and foremost, at that particular point in time, there were a lot of things that we thought we knew, but we didn't know. And moving forward, in terms of the experiences that we've gleaned for the last 12 months or so, we felt that in terms of the new models for the purpose-built dorms, we could pilot it by actually owning the land, building it, and leasing it to some of these dorm operators, or perhaps even the larger employers, for them to be able to operate. So they lease it from us to operate. Now, obviously, this is not the only model. We want to take a more holistic and comprehensive review, including getting feedback from the dorm operators and some of the employers, because ostensibly we are also aware of the significant constraints, the difficulties in terms of the costs structures that they have to bear with during this particular period. So all things will be taken into consideration while we review this.
And how will you ensure, or how will the Manpower Ministry ensure that operators adhere to the guidelines and keep workers in a safe, clean environment?
Well, obviously, by expanding and streamlining the Act to cover more of the dorms, as I've alluded to earlier on, including the FCDs, the construction temporary quarters and the temporary living quarters itself, will be one step forward in terms of making sure that the Act covers close to 100% of all of the dormitories today that exist in Singapore. We have also stepped up inspection checks. In fact, on a yearly basis from 2016 to 2019, we conduct about 1,200 inspections a year. Just in the last 9 months of 2020 alone, we've conducted 45,000 of these inspections, ostensibly because of the COVID-19 crisis. we've got fast teams that's on the ground. These fast teams actually go in, they work with the dorm operators, they educate them on the safe living measures, and they make sure that both the dorm operators, the workers, the residents themselves actually adhere to these safe living measures. On top of that, we've also set up infection prevention control practices whereby we conduct regular audits to make sure that many of our workers and the dorm residents, in fact, all of them who live there, adhere to these things, including educating them and orienting them. And obviously, at the one-stop Migrant Worker Onboarding Centre, an inherent part of this settling in program would be to educate them on how to take care of their own hygiene.
Yeah, that is exactly my next question, because we heard you speak earlier a little bit about this Migrant Worker Onboarding Centre. But I'm curious as to what do you think the limitations of this are, and which are the areas that will be perhaps more difficult to enforce?
Well, today, the employer actually has to coordinate significant steps on his own. And you can imagine that with the thousands of employers, with the tens and hundreds of thousands of migrant workers, this can be quite a difficult exercise. So what we have done is that we are providing a one-stop, comprehensive, seamless, integrated end-to-end center. And on top of doing all of their screening, we provide the stay-home notice at one particular center, plus there's 7 days of additional sort of testing that's required to make sure that we mitigate and minimize the risk of transmission. Now, over and above that, we've also enhanced the medical screening. Today, the medical screening does a lot of the like what they say, the screening, but this will entail a more comprehensive medical examination to pick up pre-existing chronic conditions so that our care, instead of being episodic, can be a more longer-term care, and we can actually tailor it more to fit the individual migrant worker and to make sure that it's a lot more targeted.
And I understand it's not just the physical well-being of the migrant workers that you're thinking of targeting, it's also issues like salary underpayment or non-payment as well, and you're looking to sort of automate those sort of e-payments as a way to sort of take the burden off the employer and also safeguard the employee.
Yes. So you're absolutely right, Steve. So what we've done is that in the last many months, for all of the residents living in the dorms, 97% are now on e-payment. The e-payment allows a very clear digital recording of what has transpired, and any sort of instances of underpayment can be dealt with very expeditiously. Now, for the balance 3%, we are going all out to encourage them. Some, obviously, because of the smaller dorms, because of lack of access, and sometimes you just need to nudge some of these workers because they want to have cash to move on to this type of e-payment system itself. On top of that, based on the integration of these centres together, we also want to start to look into the mental and the social well-being of each one of these migrant workers.
That's the mental health. It's a holistic approach,
Yes.
I presume. And in terms of the mental health, there's a new task force set up last year to enhance their mental health care support for this particular group. And can you share with us then what the task force found to be some of the key areas of concern and what the workers told you were some of their concerns?
So the task force is called DAWN, right? DAWN is an acronym. The D stands for depression, because that's really the most common problem we deal with in the dormitory. And the A stands for awareness, right? So an awareness of the fact that this depression can hit us any particular point in time. The W is wellness, mental wellness. And N, normalization, because obviously after they go through that episodic reactive reactive depression, to bring them back to what is normal community and normal work kind of ethos, that is also a very important recovery process. So to that end, the DAWN Task Force sort of has developed a 7-point strategic initiative to go and make sure that we tackle. Some of it includes mental well-being, awareness of depression, surveillance, identification of risk factors, timely escalation of the care, providing access to counselor, para-counseling, and the last bit, the post-intervention normalization part. So we've gone into phase 1. The phase 1 is where we set up this network in terms of mental surveillance, identification. Then We go on to phase 2 subsequently, very, very quickly, making sure that appropriate care is established. And then, of course, eventually this normalization part. So we've worked with NGOs, we've worked with volunteers, and it's a whole of government effort as well, including partners from IMH, Institute of Mental Health, government psychologists, our FAST team, and all of us coming together. So it's gaining some traction. We are beginning to see some early results, but early days yet. So hopefully in the months ahead, I can share with you even more good news.
Well, we'll welcome you back then as well, Dr. Tan. Thank you so much for being with us. We've been speaking with Dr. Tan See Leng, Second Minister for Manpower there.